I think my mother, who's a public health nurse, subconsciously steered me towards medicine. As a young kid, I thought I was choosing it of my own volition, but in hindsight, I think she had a lot to do with it. And I became very fixed from a young age on becoming a doctor, so I worked in medical environments, volunteered in hospitals, that kind of thing. I chose internal medicine after rotating through everything in med school and deciding that I liked complicated cases and the excitement of the emerge without being in the emerge full time, so that's why I landed on internal medicine.
In addition to her vast knowledge of medicine, she also impresses on learners an enormous work ethic that really, I feel, rubs off on learners.
I think probably without even knowing it, she's a really good teacher on the art of medicine. So she has a very caring, empathetic approach to her patient, and she, I find, really goes above and beyond. So she makes sure that they have dictation summaries, discharge summaries, so they know what their care was and what they need to do. She always is very professional with the staff, and she really has a passion for medicine that I think is obvious when she's interacting with her patients and colleagues.
And teaching here comes very easily and naturally because I find the students we get, particularly from the Northern Ontario School of Medicine, are delighted by interesting cases, as I am. So it's nice when you have an enthusiastic learner. It's very easy to transfer your enthusiasm about the case over to the learners.
The amount of skill and knowledge I've acquired over the years, a lot of it I owe to Dr. McKenna.
I hope I inspire the students just to remain enthusiastic about interesting cases and also to maintain their curiosity. The medical students here ask great questions. They're very curious about disease and disease process. And I hope that they, like me, aren't kind of ground down by the amount of work we have to do and still have time in their consultations to ask the guy who managed to, get stuck up a tree and have a heart attack up that tree, not just about his vascular risk factors, but to ask him what the heck he was doing up the tree in the first place, because that's the curious part about medicine, and we get to meet really interesting, sometimes entertaining patients every day, and you don't want to lose that curiosity.
Thank you for Dr. McKenna for all the knowledge you've imparted, all the time you spent with myself and the other learners, and just the investment that you've made for our education.
Thanks to Dr. McKenna, myself, all the internal medicine team here, all the CCU nurses, respiratory therapists, medical learners, even the nurses, physiotherapists, everyone that works out on the floor, has learned something from Dr. McKenna and will continue to learn from Dr. McKenna, and we all, from the bottom of our hearts, thank you for that and congratulate you on this award.